afternoon and welcome everyone to Infection Control Reminders during respiratory virus season. I'm glad you're all able to join me today. We're going to give it a couple minutes for everyone to join. So as we're waiting, please feel free to introduce yourselves in the chat and where you're from, and also complete the pre-session survey. The link is in the chat. And that survey will be required if you are looking to receive CNE, CE, or certificate of training for today's session. So I am happy to present this webinar again, as I did last year. Today's webinar has some important updates from last year, and since we are entering into respiratory virus season, this is a great time to share this with you again. This session is brought to you by Project Firstline Rhode Island under the Center for Acute Infectious Disease and Epidemiology at the Rhode Island Department of Health in partnership with the CDC. And I'd like to thank you all for taking time out of your busy day and joining me. And I also want to thank you for all your dedication and care you deliver to our community in your healthcare role. For those who don't know me, my name is Lisa Ledoux. I'm an infection prevention training liaison for Project Firstline Rhode Island. I've been a nurse for over 32 years, and my professional experiences have been in many different settings. And even though my nursing roles and responsibilities have varied over the years, infection control and prevention have always been in the forefront of my nursing practice. At this time, I'd like to introduce Dr. Kearney.
Good morning, everyone. I'm Alexis Kearney. I'm an emergency medicine physician and also the consultant medical director here at Project Firstline. And we are super excited to be here with you today. I'll be in the background answering any questions that might come up throughout Lisa's presentation. Thanks for being here.
Thanks, Dr. Kearney. And I also would like to introduce Abby Anderson, who is our Project Firstline Rhode Island project assistant. And Abby will be posting information for you throughout the webinar via chat. And we'll also have some interactive activities and knowledge checks throughout this webinar. So I look forward to your participation. And I have the Project Firstline team there behind the scenes in support of this webinar. And before we begin, for all of you attending today's webinar, you will be emailed a copy of this PowerPoint slide deck with links to resources that I referred to throughout the webinar. Okay, so here are the continuing ed criteria for those of you who are attending and would like to receive CNE or a certificate of training. For those of you who are looking to receive a certificate of training, EMS-CE, or dental IPC-CE, you'll need to complete the following: the pre-session survey, and attend this entire live webinar with me, and then the post-session survey, which will be emailed to you tomorrow. And for those of you who are looking to receive CNE, you will need to complete the following: the pre-session survey, attend the live webinar, and a post-session survey and a post-session quiz, which will be emailed to you again tomorrow. So fall and winter are a time when viruses that cause respiratory disease usually circulate more heavily in the community. Being sick is never fun, but that's especially true when we're not ready for it. We've all been there, shuffling down a pharmacy or a grocery aisle feeling awful, looking for cold medicine products or chicken noodle soup. But preparing for respiratory season is not only about stocking up on tissues and cough drops. As frontline workers, healthcare staff play a crucial role in protecting patients, coworkers, and themselves from getting sick, especially during respiratory virus season. As we are currently heading into respiratory virus season, it's important now more than ever to emphasize these infection control actions that you can take in your healthcare role. As healthcare workers, you need to be prepared, and it's important to have awareness of what types of respiratory viruses that are currently circulating, what are the symptoms of these particular viruses, and who's at risk of getting sick. Respiratory virus season doesn't have an official start or end date, and because of this, it's important to be prepared. Last year's respiratory virus season, we saw a considerable spread of COVID-19, flu, and RSV, which led to an extra stress on an already overwhelmed healthcare system. While we expect this season's peak hospitalization rate to be similar or lower than last year, there is still a risk of a higher peak rate, underscoring the need to plan and be prepared. Regardless of your healthcare setting or which respiratory viruses are spreading in your community, there are existing infection control measures you could take to slow the spread of these viruses and to help protect your patients, yourselves, and your families. When respiratory viruses are spreading in the community, the risk for healthcare settings increases as well, the risk for spread in the healthcare settings. The intention of this session is to remind you that there are infection prevention actions that you can do as a healthcare worker to prevent the spread of viral respiratory infections in healthcare. And here's our agenda. We just did our welcome and introductions. And again, please feel free to put your name and where you're from in the chat. We're going to review the learning objectives next, then go over the common respiratory viruses that we are planning to see circulating in this respiratory season, infection control actions that you as healthcare workers can take to protect yourself and your patients. We'll have a quick reflection, key takeaways, announcements, end of session feedback, and a Q&A. So after the session, you'll be able to identify common respiratory viruses and how they spread and cause infection, understand the impact of increased respiratory virus rates in our healthcare system, and review infection control actions used to protect ourselves and our patients. So here's, we're going to start with the knowledge check, true or false statement. So if you can put your answers in the chat. Respiratory virus infections occur year-round. Is this true or false? What do you think? You can put your answers in the chat. Respiratory virus infections occur year-round. Yeah, good. Thank you. Yes. And the answer is true. Germs live in reservoirs in and on our bodies. One reservoir where germs live in the body is the respiratory system. The respiratory system consists of upper and lower airway. The upper airway includes the nose, throat, and trachea, also known as the windpipe, and the lower airway includes the lungs. Many germs live in the upper airway, and germs in the nose and mouth can easily be spread to the skin and the hands when you touch your face, and then from there they can spread to surfaces and other people. When an infected person talks, breathes, sneezes, or coughs, they produce respiratory droplets that could spread germs. And these germs are more likely to spread in places with poor ventilation or closed in areas with many people. And next slide. There we go. Okay. So let's review. What is a respiratory infection? A respiratory tract infection is an infection of the lungs, airway, sinuses, or throat. And as we know, respiratory infections can occur year-round. However, there is a significant increase in these infections during the fall and winter months, which we commonly call the cold and flu season, when people tend to spend more time inside in enclosed areas. During cold and flu season, it helps to know what types of viruses are spreading, their symptoms, and how to avoid spreading illness to those around us. Learning to recognize infection risks in healthcare means learning to identify moments throughout your workday when there is an opportunity for germs to spread and make people sick. To recognize these opportunities, we need to know where the germs live. They're known as their reservoirs. How they can get from place to place, or people, surfaces to people and person to person through a pathway. When we refer to a pathway of infection, we refer to touch, splashes and sprays, clinical care, and breathed in. The first pathway is touch. That usually involves the skin, especially the hands, but it also happens with shared devices, which touch different people and surfaces. Germs can spread by touch via a handshake, touching an object such as a cell phone, keyboard, door handle, or any medical device. Another pathway is through splashes and sprays of blood or body fluids. Germs in these splashes or sprays can get into a person's eyes, nose, or mouth, or into a break in their skin and cause infection. A third pathway for germs to spread in healthcare is through clinical care. And these tasks can bypass or break down the body's natural defenses, performing clinical tasks that creates a pathway for germs to enter the patient's body. These infections are side effects and risks associated with a medical intervention. And the last common pathway is for germs to spread through respiratory particles that are breathed in. Exhaling of infectious respiratory particles that can be by sneezing or coughing or singing. The common respiratory viruses that we're going to discuss today are RSV, flu, and COVID-19. These respiratory infections are all highly contagious. The respiratory syncytial virus causes RSV infection. Influenza virus causes the flu. And SARS-CoV-2 causes COVID-19. And it is possible for a person to be infected with multiple viruses at the same time. And while these respiratory viruses are more common in the respiratory season, they can also circulate in different times of the year and cause severe illness to people with underlying illnesses or weakened immune systems. Respiratory syncytial virus, or RSV, is a common respiratory virus that usually causes mild cold-like symptoms. Most people recover in a week or two, but RSV can be serious. Commonly, some think of this infection that it only affects babies or young children, and that is not true. RSV can affect any age. And the next common respiratory virus, influenza, also referred to as a flu. While seasonal influenza viruses are detected year-round in the United States, flu viruses typically circulate during the fall and winter during what's known as flu season. The exact timing and duration of flu season varies, but flu activity often begins to increase in October. Most of the time, flu activity peaks between December and February, and in some cases, it can last as late as May. And the last virus we're going to discuss today is SARS-CoV-2, COVID-19. This virus is well known to all of us. COVID-19 is caused by a virus, as we known as SARS-CoV-2, and it can be very contagious and spread quickly. All these viruses have very similar symptoms, but they can cause mild to severe illness depending on the age and the health status of the individual. And depending on the severity of symptoms, hospitalization may be required. So we're going to go into each of these viruses in detail next. RSV is increasingly recognized as an important public health concern. I'm not sure if any of you have seen the commercial recently on TV, the RSV commercial. It has adults infectiously laughing, and it states how a laugh can be so contagious just as much as RSV, and laughing aloud can spread those infectious droplets in the air for others to breathe in. There was a surge of RSV infections 1 year ago and it overwhelmed hospitals. Since then, there's been a slow decline of reported cases. RSV is the most frequent cause of bronchiolitis, which is an inflammation of the small airways in the lung in infants, and it's responsible for more severe respiratory complications and casualties than COVID-19 or flu in children. Most people who get RSV infection will have mild illness and will recover in about a week or two. When some people, however, are more likely to develop severe RSV infections and may need to be hospitalized. Antibiotics do not help treat RSV. And RSV can spread when an infected person coughs or sneezes or laughs. You get the virus droplets from a cough or sneeze in your eyes, nose, or mouth. If you have direct contact with the virus, like kissing the face of a child who has RSV, touching a surface that may have the virus on it, such as a doorknob, and then touch your face before washing your hands. RSV can survive for many hours on hard surfaces, such as tables and crib rails. It typically lives on soft tissues, such as your hands, or even like tissues that we use for blowing our nose, and it can last for shorter amounts of time on those, but they do survive and they could survive on hard surfaces for many hours. People infected with RSV are usually contagious for 3 to 8 days and may become contagious a day or two before they start showing signs of symptoms. Of these symptoms, and RSV can also make chronic health problems worse. RSV can be dangerous for some infants and young children. Each year in the United States, an estimated 60,000 children younger than 5 years old are hospitalized due to RSV infection. Almost all children will have RSV infection by their second birthday, whether it may be mild symptoms or severe symptoms. And some infants and people with weakened immune systems can continue to spread this virus even after they stop showing symptoms for as long as up to 4 weeks. Children are often exposed to and infected with RSV outside of the home, such as in schools or childcare centers, or even doctor office, the pediatrician's office. They can then transmit the virus to other members of the family. RSV can also cause more severe illness, such as bronchiolitis, which we mentioned. It is the most common cause of bronchiolitis and pneumonia in children younger than 1 year of age. So those that are at greatest risk for severe illness for RSV include premature infants, especially those 6 months or younger, young children with congenital heart or chronic lung disease, young children with compromised or weakened immune systems or a medical condition, and children with neuromuscular disorders. RSV infections could also be dangerous for certain adults. Each year, it's estimated that between 60,000 and 160,000 older adults in the United States are hospitalized, and 6,000 to 10,000 die due to RSV infection. RSV can exacerbate pre-existing respiratory conditions in adults and may cause serious respiratory illness in the elderly. And adults that are at highest risk for severe RSV include, the older adults, adults with chronic heart or lung disease, adults with weakened immune systems, or those with certain or other underlying medical conditions, and also adults living in nursing homes or long-term care facilities. Okay, so here is our RSV knowledge check, and I invite you to participate as you did before and put your answers in the chat box. They're true and false. First one, RSV affects only infants and children. Is this true or false? Excellent. And the answer is false. You all got that. Great. Antibiotics are helpful in treating RSV. Is this true or false? Excellent. And the answer is false. You guys all got that. Great. And last, RSV infections send approximately 60,000 young children over the age of 5 years old to the hospital yearly in the United States. Is that true or false? Fantastic. And the answer is true. Great job. Thank you. Thanks, guys. We're moving on to our next virus here, influenza. Flu is a contagious respiratory illness caused by influenza viruses that affect the nose, throat, and sometimes the lungs. It can cause mild to severe illness and at times can lead to death. Influenza virus spreads easily during the winter months when people spend time indoors together. There are 4 types of influenza viruses, A, B, C, and D. Influenza A and B viruses cause seasonal epidemics of disease in people almost every winter in the United States, right? We call that the flu season. Influenza A viruses are the only influenza viruses known to cause flu pandemics, which these are global epidemics of flu disease. And a pandemic can occur when a new and different influenza A virus emerges that infects people. It also has the ability to spread efficiently among people and against which people have little or no immunity. Influenza C virus infections generally cause mild illness and are not thought to cause human epidemics. And influenza D viruses primarily affect cattle with spillover to other animals, but are not known to infect people or cause illness. The virus is transmitted easily from person to person by tiny droplets made when people with flu cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby. It is not It's not that common that a person might get flu by touching a surface or object that has flu virus on it and then touching their own mouth, nose, or possibly their eyes. Most infected people recover within 1 to 2 weeks without requiring medical treatment. So who's at risk for the flu? All age groups can be affected, but there are groups that are more at risk than others. Anyone can get flu, even healthy people, and serious problems related to flu can happen at any age. But some people are at higher risk of developing serious flu-related complications if they get sick. And this includes people 65 years and older, people of any age with certain chronic medical conditions such as asthma, diabetes, or heart disease, pregnant people, and children younger than 5 years old. Healthcare workers are at high risk of acquiring influenza virus infection due to increased exposure to the patients and then risk further spread, particularly to vulnerable individuals. In the very young, the elderly, and those with other serious medical conditions, infection can lead to severe complications, causing pneumonia and possibly death. And here's our knowledge check for the flu. You can spread flu to others even before symptoms appear. Is that true or false? All right, yes, good job. And the answer is true. Very good. Flu illness can be more severe for certain people. Is that true or false? Fantastic. And the answer is true on that one. Very good. And last, there's only one strain of the flu. Is that true or false? No, good job. And the answer is false. We just went over there are 4 different. Very good. Thank you for participating. And last, SARS-CoV-2, COVID-19. It's caused by coronavirus. The virus spreads very easily to other people. And some infected people have no symptoms, but others can get very sick and, as we know, can die from this. COVID-19, coronavirus disease of 2019, is a disease caused by the virus called SARS-CoV-2. It can be very contagious and spreads quickly. COVID-19 most often causes respiratory symptoms that can feel much like a cold, the flu, or pneumonia. COVID-19 may attack more than just your lungs and your respiratory system. Other parts of your body may also be affected by this disease. And many people with COVID-19 have mild symptoms, and some can be, like I said, can become very, very ill. It spreads when an infected person breathes out droplets and very small particles that contain this virus. Other people can breathe in those droplets and particles. It can land in their eyes, nose, or mouth. In some circumstances, these droplets may contaminate surfaces that can be touched. Anyone infected with COVID-19 can spread it, even if they do not have symptoms. So who's at risk for COVID-19? Well, some people, like I said, may not even have any symptoms at all, and then others can become very, very sick and need to stay in the hospital and may eventually even be on a machine to breathe, a ventilator. The risk of developing dangerous symptoms of COVID-19 may be increased in people who are 65 years and older. And the risk may also be increased in people of any age who have other serious underlying health issues, such as heart or lung conditions, weakened immune systems, obesity, or diabetes. And each of these factors can increase the risk of severe COVID-19 symptoms. But again, people who have several of these other health problems are at even higher risk. And here's our last knowledge check, and it's for COVID-19. COVID-19 is caused by the virus SARS-CoV-2. Is that true or false? And the answer is true. Excellent job. Anyone infected with COVID-19 can spread it, even if they do not have symptoms. Is that true or false? Great participation. Thanks, guys. And the answer is true. Very good. And last, COVID-19 does not spread easily. True or false? And the answer, I think we all know the answer to that. It's false. Great. Thanks again. I appreciate your participating. Symptoms of all these viruses are more similar than they are different. They may look different in different age groups. All have similar treatments that are based upon supportive care, including comfort measures and assuring adequate hydration. The highlighted symptoms are the ones that are more specific to that particular virus. So with RSV, people infected with RSV usually show symptoms within 4 to 6 days after getting infected. These symptoms usually appear in stages and not all at once. And in very young infants with RSV, the only symptoms may just be irritability, decreased activity, and breathing difficulties. Most symptoms of RSV are similar to flu and COVID, except the highlighted ones, which you see there: a decrease in appetite, sneezing, wheezing, dehydration. In the flu, signs and symptoms usually come on suddenly with the flu, and people who are sick with the flu often feel some or all of those symptoms that you see up there on the screen. COVID-19, again, same symptoms, but what makes COVID-19 different are the symptoms of loss of smell and taste. And some people may have vomiting and diarrhea, though this is more common in children than adults, and shortness of breath from RSV is more common in infants than younger children. So do you think you have a respiratory virus? It is difficult to determine which respiratory virus it might be. And here are some questions to possibly help narrow it down. Did those symptoms come on gradually or suddenly? How long has it been since possible respiratory virus exposure? If I went to a party and got sick the following day and woke up with a fever and a sore throat, do I have allergies? Do I have a cold or flu? Or is it COVID-19? And am I contagious, and for how long? The only way for certain to diagnose which respiratory virus you may have is to get tested. And testing is the only solid way to know what virus it is, the length of incubation, knowing how long to stay home when sick, keeping distance from others, and what symptoms to monitor. Also, when you are definite on what virus you have, you can notify people that you were in contact with to let them be aware and monitor themselves for their symptoms. That you may need to be away from family members who are frail and easily susceptible to the virus. Remember, you can be contagious and not show any symptoms. The CDC created this dashboard called RespNet, the Respiratory Virus Hospitalization Surveillance Network. It has 3 platforms that conduct population-based surveillance for lab-confirmed hospitalizations associated with COVID-19, influenza, and RSV among children and adults. The rates presented on this RespNet interactive dashboard can be used to follow trends, compare the 3 different viruses, the hospitalization rates in different demographic groups. You can filter it by age, sex, race, ethnicity, and across the seasons. Surveillance for COVID-19, influenza, and RSV in RespNet relies on clinical testing ordered by a healthcare provider. RespNet does not collect data on all hospitalizations caused by respiratory illnesses, but it can describe hospitalizations caused by these 3 different viruses that account for a large proportion of these hospitalizations. And Abby will show the link to the site. And here is, when you go into RespNet, this is how you could pull up the graph. And this information I just got last Friday, October 4th. It gets updated every Friday. Their stats, their rates. So you can, as I mentioned, you can go in by topic of interest, right? You could check and see, among age and sex and ethnicity, and check that out. You could also filter it by pathogen, and you could also select what kind of view you want to have the data displayed. This graph is the one that I chose to use, but there's also tables. And in this image, you can see the black line indicates the combined number of cases, which is a combination of RSV, flu, and COVID-19. The red line indicates the number of COVID-19 cases. The blue line indicates the number of flu cases, and the green line indicates the number of RSV cases. So again, Abby will show that link. You could check that site out, and again, it gets updated every Friday. And here's another site I wanted to share with you, another site that the CDC has for you to look up the amount of respiratory illness in your community. So you could do like a community snapshot of the amount of illness causing people to seek healthcare. So you can, click on, you see on the screen, I went into Rhode Island, and it says right there that our level is low right now, right? So it will indicate if it's low, minimal, or high. And again, this site gets updated every Friday, and Abby will show a link to that. When these viruses are spreading in the community, the risk for spread in the healthcare settings increases as well. And this is where, if you would like to participate, I appreciate it. What are some infection control actions that you do now that help to decrease the spread of respiratory virus? If you want to share and put your answers in the chat, what are things that you do? I see source control, absolutely. Masks, hand washing is huge. Yes, respiratory hygiene, hand washing. Yep, Holly, I just said it. Hand washing is key, yes. Promote vaccination, fantastic. Those answers are all great. Absolutely. So let's continue to review some infection control actions that you can do. And most of you have mentioned them, which is fantastic. So we're gonna, the good news is that we all have the tools to prevent the spread of infection to others. And we're gonna go through each of these actions that you can take. Correct use of masks and respirators, cleaning your hands, clean and disinfect objects, practicing physical distancing, vaccinating, ensuring HVAC is maintained, and practicing good healthy habits. I'm going to go into each of these in more detail. So first, correct use of masks and respirators. Consider masking as a source control in healthcare facilities during respiratory virus season. Source control is an important tool to keep germs from spreading. It stops germs at their source before they can spread to other people. Well-fitting face masks or respirators covering a person's mouth and nose can prevent spread of respiratory secretions when people are breathing, talking, sneezing, coughing. It is recommended that source control be used by people with symptoms of a respiratory infection and those who are recently exposed to someone with a respiratory infection. The overall benefit of broader masking is likely to be greatest for patients at high risk for severe outcomes from respiratory virus infections during periods of high respiratory virus transmission in the community. Facilities could consider expanding mask use in their situations by operationalizing broader mask use in a facility. It could include recommending healthcare workers to use masks for certain types of patients or during a typical respiratory virus season. Use of masks and respirators by healthcare workers, patients, and visitors will help decrease the spread of respiratory viruses. Even when masking is not required by a facility, individuals should be allowed to use a mask or respirator if they choose. Masks can help block droplets from being released in the air and breathed in by someone else. So when you are applying a mask or putting one on, you want to wear a mask to protect yourself and others, right? You want to wear a mask that fits you properly and wear a mask the correct way. I mean, I don't know about you, but I still am seeing people wearing the masks incorrectly, and obviously it's not as beneficial. So if your facility does decide to institute masking, Project Firstline Rhode Island has created signs to help encourage masking that you can download and share and print. And if Abby doesn't have that link right now, we will have that with our end of session resources. They're great posters if you'd like to share them. Okay, and the second infection control action, and a lot of you mentioned it, is cleaning your hands. Good hand hygiene is critical. I can't stress it enough how critical it is, right? Hands are the main way germs spread in healthcare settings. Clean hands are safe hands. Cleaning your hands regularly with an alcohol-based hand sanitizer or soap and water is a simple yet very effective tool to stop the spread of germs. You want to clean your hands the correct way. Make sure there is consistent access to hand sanitizer dispensers and supplies for hand washing throughout the facility. If proper hand hygiene is not performed, remember, germs can spread from person to person or from surfaces to people by the following: touching our face, eyes, and nose and mouth, preparing foods or eating foods and drinks with unwashed hands, touching surfaces or objects that have germs on them, blowing your nose, coughing, or sneezing into your hands, and then touch other people's hands or common objects. Also practicing respiratory hygiene and cough etiquette. And there's a poster you can see on here, infection control actions. Abby will show the link to this poster. You can, again, download and print that. And next, clean and disinfect. Cleaning is a process that removes things like dust, dirt, grime, and other spills. Disinfection describes a process that kills any remaining germs on surfaces after cleaning. So regular environmental cleaning is a necessity. Lobby areas, cafeterias, waiting areas, all high traffic spaces. It's also important to disinfect reusable devices and do not reuse disposable devices or items. Clean commonly used objects often and clean commonly touched surfaces. It's important to clean high-touch surfaces, as I mentioned earlier, your door handles, elevator buttons, stair rails. It's imperative to disinfect areas in your facility where people or patients are ill. Waiting rooms, pediatric waiting rooms, or the toys in the pediatric waiting rooms. It's also very important to disinfect reusable devices and shared medical equipment among patients. Right? Think about all the objects that are touched by so many every day. And fourth is practicing physical distancing. Physical distancing means keeping a space between yourself and other people. Putting physical distance between yourself and others can help lower the risk of spreading a respiratory virus. The closer you are to someone who has a respiratory illness, the more likely you are to catch it. You can consider the following in your facility, implementing screening and triage protocols. Monitor those waiting rooms and ensure that patients are distanced. If a person is in the waiting area and appears to be ill with cough and congestion, offer a mask, or if you can, move that patient to a single room. Assess the number of people on an elevator and avoid if overcrowded, especially if you're transporting patients. Staying home from work or school if you're sick. And also utilizing telemedicine or telehealth appointments for your patients when it's appropriate. Vaccination. We know that vaccinating is a public health measure that reduces the spread of infectious disease and absenteeism. Currently, there is a vaccine, which is wonderful, for each of these viruses that we just discussed. There's a vaccine for RSV, for flu, and COVID-19. And as healthcare workers, you want to provide accurate and up-to-date information regarding vaccinations to your patients. Assure your patients have a clear understanding of the importance of getting vaccinated to protect against these viruses. And teach your patients to have communication with their PCP regarding vaccination schedules. It's important to instruct your patients to keep those routine visits with their physicians also. So why immunize? We know that it's the best defense against viruses that can cause serious illness. Thousands of people are hospitalized for COVID-19, RSV, and flu. And RSV is the number one reason for infant hospitalizations. And vaccinating cuts the risk of hospitalizations in half. Here's a timing and administration, the timing and administration of COVID-19, influenza, and RSV immunizations. Now is the time to get vaccinated, right? Right now in October, we're right at the beginning of October. Have your patients talk to their provider to see which vaccines they should receive and when they should receive them. Okay, moving on to number 6, another infection control action is to ensure HVAC maintenance is up to date. As you go about your workday, see if any vents are blocked by an object that you can move easily. There may be a trash bin blocking a vent in an exam room. You want to move that so you have proper ventilation. Consult with facilities management to ensure that your HVAC system is working efficiently for proper ventilation. And it's good to have knowledge and understanding of your ventilation system. And, if you have any questions or any concerns, I know who to contact also. And our last infection control reminder is practicing good health habits. Self-care is one action that most of us do not do, or we do not put it high on our priority list. But it's so important, right? Because what do we do as healthcare providers? We are, we take care of everybody else except for ourselves. Make sure you get that good sleep, get as much sleep as possible. Try to be physically active, manage your stress, drinking plenty of fluids and eating nutritious food, and staying home if you are feeling sick. Take the time to do these things for yourself. I know it's very hard and it's easy to say it, but this will allow you to remain strong and healthy in your rigorous day-to-day lives. And here's just a recap of all these infection control actions. Correct use of masks and respirators, cleaning your hands, clean and disinfecting objects, practicing physical distancing, vaccination, ensure HVAC maintenance is up to date, and practicing those good healthy habits. Here's these are great posters, and Abby will show the link to these. One is on germs can live in the respiratory system, and the other poster is what to know about ventilation in the healthcare setting. And again, Abby, thank you. She'll show the link to that. So as we end this refresher, next slide, sorry. As we end the refresher, I'd like to, have you all reflect and take a moment to think about this question. And again, if you would like to participate, put your answers in the chat, that'd be great. How can you help yourself and your coworkers take the correct infection control actions to keep germs from spreading the next time you see a patient coughing or has congestion? After this refresher, hopefully you can take a lot of this information and apply your infection control actions. What are some things that you would do? Offering masks, right? We're going to definitely offer a mask if we see anybody with cough and congestion. And all these other control actions that we just went through, hand washing. And thanks, Stephen. Yes, encouraging mask use, hand hygiene, and cough etiquette. Yep. Keep each other's backs, looking out for each other, create a culture of mutual support so that all staff are comfortable. I love that, and helping one another. Hand sanitizer. Is there a difference in the disinfectants you need to use for 3? Oops. Oh, Deborah, we'll address that question. I do see that question. But thank you for participating, because these are very important and I appreciate all your answers. These are great. So, we all own the duty to protect our patients, right? By maintaining these actions in your practice, you're going to protect yourselves, your coworkers, your patients, and also your family members from getting sick. All right, key takeaways. Being informed and prepared will help decrease the impact of respiratory virus hospitalizations in our healthcare system. Respiratory viruses are highly contagious, spread easily, and can cause serious infection to everyone. Those who are immunocompromised are at increased risk. Infection control actions decrease the spread of respiratory viruses. Having the knowledge and tools on how to decrease the spread of respiratory viruses is vital in your role. Practicing all these actions will help protect yourselves and your loved ones. So just a quick go over the reminders here for the requirements for your certificate of training. In order for you to get your certificate of training, you must have completed the pre-session survey, and also a link for the post-session survey will be emailed to you tomorrow on October 8th, and it will be available until October 15th at midnight. Once you complete the requirements, a certificate of training will be emailed to you in PDF form on October 18th. And please be sure that if you're looking for CNE credit, that you complete the post-session survey with the post-session quiz, okay? And again, you will receive this PowerPoint and resources emailed to you this afternoon. Before I go over our upcoming webinars, I just want to mention there are 2 recorded webinars from the CDC. One is from August 6th, and it's COVID-19, flu, and RSV, a 2024 update from the CDC. And Abby will show the link to that webinar. And also September 16th, 2024-2025 respiratory virus season updates for long-term care providers. And we will post that recording as it becomes available from our CDC partners. But Project Firstline Rhode Island, we have some exciting upcoming webinars that we will be presenting live. On October 21st, my colleague Jacob Peguero will be presenting Recognizing Infection Risk for EVS Personnel in Spanish Language. We're trying to reach out to as much EVS colleagues as much as possible, so if you could help spread the word to your EVS team. And then on November 4th, my colleague Stephanie Doyle will be presenting Preventing C. diff infections, and she will have some updates on that. And then on November 18th, Jacob Peguero will be presenting Blood. It's a quick IPC refresher, and this is a great 30-minute session where Jacob will go through case scenarios reviewing IPC actions surrounding blood. And Abby will show the link on how you can pre-register for these courses. And if you did not enter your email earlier in the chat, please feel free to enter it now if you want to be added to our distribution list of upcoming trainings. And follow us on YouTube, Twitter, Facebook, Instagram, and LinkedIn. And here are the references used for today's presentation. And I invite you to take this 3-question poll that's on your screen. This helps us to improve future sessions and assess your community learning needs. So I'll give you some time to fill that out, and then we will move on to the Q&A if we have any questions. And Dr. Kearney will come back on camera. All the
Thanks,
work,
everyone.
yes, we appreciate it very much. Thank you.